Hi, my name is Javier Escaned, and I have the pleasure to announce a new chapter of the PCR-EA-PCI textbook of Percutaneous Interventional Cardiovascular Medicine. The chapter is entitled Functional Coronary Angiography to Assess Epicardial Vessels and the Coronary Microcirculation. What is functional coronary angiography? Well, functional coronary angiography is the latest development in a long history of a very important diagnostic technique. Over long segments of its history, coronary angiography was informing on the presence or absence of coronary stenosis, but without providing information on the flow-limiting characteristics of these narrowings. Over the last 10 years, we have witnessed the development of a number of techniques purely based in angiography that provide functional information about coronary stenosis. How does it work? Typically, functional coronary angiography works by combining information obtained with three-dimensional reconstruction of the coronary arteries with computational fluid dynamics, by generating, therefore, information on whether these stenosis that are located in the coronary vessels are flow-limiting or not. These techniques are already available in our cath labs. Actually, what we will do in this chapter is focusing on those techniques that have already approved and commercialized, and that therefore can be incorporated to your practice. You will recognize many features that have something in common with the use of pressure guide wires, but you will also realize that you have distinct advantages of having co-registered, so to speak, the physiological information obtained in the coronary arteries with the anatomy, favoring subsequent actions and perhaps decreasing the possibility of geometric mismatch. QFR will be one of the techniques that we will be analyzed more in depth. Recently, the February 3 China trial demonstrated that this technique is actually superior to angiography alone in making decisions on revascularization. By not having to instrument the coronary arteries to perform functional analysis, there is a hope that functional coronary angiography will facilitate adoption of functional revascularization in clinical practice. Of note, these techniques can be applied in the cath lab in real time. Information can be transferred to workstations where decisions can be made in a matter of minutes. Many authors have been interested in exploring the use of functional coronary angiography in particular subsets. One of them is acute coronary syndromes, the other one is in-stent restenosis. There are multiple subsets that are analyzed in the chapter of the PCR-EA-PCI textbook. More recently, the use of functional coronary angiography has been expanded to interrogate also the coronary microcirculation, and it has been demonstrated that you can obtain information on microvascular resistance, which are actually comparable or similar to those that are obtained with intracoronary pressure guide wires. And there is a hope that these tools will be also facilitating measurements in patients that have, for example, ischemia without obstructive coronary artery disease. So, in summary, we invite you to visit the PCR-EA-PCI Interventional Cardiology textbook. We hope that this chapter will provide you information that is relevant for you to consider the implementation of functional coronary angiography in your clinical practice. Thank you.